Hello, my name is Kunoor Jain-Spangler, and I am a general and bariatric surgeon at Duke University. My talk today is on being the bariatric champion and building the multidisciplinary team. I have one disclosure seen here that is not relevant to my talk. As I mentioned before, I am a bariatric surgeon at Duke University, and I'm also the fellowship director to 3 clinical fellows since 2017. We have a busy, high volume academic practice. However, immediately following fellowship and prior to my return to Duke, I joined a community hospital bariatric surgery program with a private practice type of feel. For part of my time there, I was also the MBS director. Today, I have been asked to talk about being the bariatric champion and also building the multidisciplinary team. I feel that having seen multiple ways to run a bariatric surgery practice has provided me good experience and insight into these topics. So, what does make a champion? In this instance, I believe the key elements are personality, relationships, education, rules, and the team you build. And what is a champion's personality? When speaking of this, I am not referring to a Myers Briggs personality type. I am referring to the multiple facets of our personalities that we use when interacting with other people. The important elements are availability, and by this I mean not just the actual physical amount of time you have, but more so how you make people feel about their issues and concerns. When building a center and a team, people need to feel that their leader is committed and invested in the program most of all. Affability. I grew up in the South, and the saying that you attract more bees with honey than vinegar is commonly used. The thing is that it is so very true and so very applicable to almost all parts of our professional lives. The more pleasant, kind, and generous we are with others, the more likely it is that they will work better and harder as well to ensure that the team is successful. Attitude and work ethic. The team must see in the champion a level of dedication and a can do attitude that does not allow for failure. And finally, the overall environment you create. If you stroll through your memory bank and pick out your favorite experiences in the OR or in clinic, it is likely that it took multiple people working well together to create those moments. As the champion, you should be able to put yourself in the shoes of each team member to make sure they are in an environment where they can thrive, contribute, and be recognized. The bariatric champion must be able to forge and maintain meaningful, useful, and transparent relationships with numerous people, including staff. This should include all staff members, from MAs and nurses to housekeeping staff, administrative assistants, schedulers, front desk staff, and many others. Again, details are important here. Learn their names and their kids' names. Get to know your staff as human beings with lives outside of the office or hospital, and you will be rewarded with friendships, loyalty, devotion, and a higher functioning team. If you have partners, you also need to support and be supported by them. I am a fan of transparency and equity and believe that any champion works with their partners to create success within the entire program. Bariatric champions also cultivate relationships with referring providers. Helping these providers understand what we do and why we make our recommendations goes a long way. Again, being available and affable also mean a lot to them. Finally, clinic and hospital administration must be a part of our team, and getting them to support the program and fully buy in can be invaluable. Please refer to Dr. McBride's lecture that preceded mine for great tips on this topic. Teaching is a very big part of being the bariatric champion. It should be a goal to teach as many people about bariatric surgery as frequently as possible. Prior to COVID, I would have recommended monthly staff in services, educational sessions for referring offices like breakfast with bariatrics, lunch and learns, snack and chats, or similar sessions. In the OR, you can invite those interested for a teaching day where they could come and observe a surgery to see what we do and how much safer and less invasive it is than what they likely believe. Finally, the last item here is one that is near and dear to my heart. We as bariatric champions must be vocal about obesity as a chronic disease. It is an unrelenting, frustrating, difficult to cure disease, and we need to change the culture in which we only treat its symptoms. We must ask our systems why we spend so much time and money treating diabetes, hypertension, hyperlipidemia, obstructive sleep apnea, gastroesophageal reflux disease, and so many others that can be improved and often resolved with weight loss and specifically with bariatric surgery. Every bariatric champion must know the rules. The MBSA QIP standards exist for a reason, and accreditation is important for multiple reasons, including improved outcomes, data for future research, and being able to obtain reimbursement if there are certain insurance requirements. Dr. English gave an excellent talk on the standards earlier, so I won't duplicate his words any further. So let's talk about building the team. There are certain positions that are required to become accredited by the MBSA QIP. These include the bariatric surgeon, who is also the director, any other bariatric surgeons in the program, a bariatric coordinator, clinical reviewer, and a member of the facility administration who deals with the bariatric surgery program. I also believe there are several other positions that should be created as part of the team and MBS committee, including dietitian, psychology or psychiatry, a bariatrician, exercise specialist, and office staff. Now, how do we get these people to all work together? The best place to start is to look at why teams fail. So if we start here in the brown box at the lowest end of the spectrum, we see that the lowest positivity and productivity teams have an atmosphere of criticism, blame, and cynicism. People are overwhelmed and they're not having any fun. There's fear of job loss or company failure, short-term orientation, firefighting, and turf protection. One step forward leads to 2 steps backwards, and there is poor teamwork. If we move to the middle of the spectrum, the high positivity, low productivity teams are collegial and friendship-based, but there is a lack of effective focus. There is an insufficient sense of urgency. There is resistance to change, a don't rock the boat type of attitude. Incompetence is tolerated, and the team is not results-oriented. However, there is a sense of connection and fun. In the low positivity, high productivity team, focus is efficiency. There is a just do it attitude and a bottom line orientation. There are retention problems, high turnover, and burnout. Team members are guarded, but there are clear objectives and people are driven and competitive. Finally, we get to the high positivity, high productivity teams. Here, people are successful, they're having fun. There is synchronicity and flow, challenging goals, inspiring vision, change and proactive, open communication, and great teamwork. How do we continue to improve is a question that is often asked. Another graphic I like to use to describe how to build a high-functioning team is this one. It basically summarizes the items necessary to build a high-performing team, including nipping conflict in the bud and remaining transparent, encouraging employee development, prioritizing communication, setting feasible goals, recognizing your employees, and being a true leader. Thank you so much for your time. Enjoy the rest of SAGES.